Ovarian cancer is one of the commonest gynecological cancers. In women, it's the second gynecological cancer after breast cancer. It affects women who have usually reached the menopause or beyond. The vast majority of these cases are not patients who have had a history of ovarian cancer, but history of ovarian cancer is important to take into account if a patient is worried about ovarian cancer. As far as numbers is concerned, it affects in excess more than 6,000 women every year in the United Kingdom. We do not know of any cause for ovarian cancer, but we do know there are some associations. For example, we do know that women who have been on the oral contraceptive pill have a significant protection against ovarian cancer. This doesn't mean that if a woman who hasn't been on the oral contraceptive is at high risk of ovarian cancer. We also know that there is a small proportion of women who have had a history of cancer of the ovaries or the breast in the family, but usually they are known to the GP and the gynecologist. They can develop the disease earlier. The majority of women will develop it in their 50s and 60s. Ovarian cancer was called the silent killer. What we've realized now that it's not silent, it's just that the symptoms are not specific, therefore women may not be able to distinguish the symptoms that they may get from other general symptoms. For example, we now know that if women over the age of 50 start getting bloatness and abdominal pain, sometimes they think they have irritable bowel syndrome. We believe that irritable bowel syndrome is unlikely to develop for the first time after the age of 50. It's good to be aware that if these symptoms develop suddenly and the woman feels that their appetite maybe is not so good, that the bowel habits have changed, then it's good to see the GP. The vast majority of cases, there's nothing to worry about. It's not ovarian cancer. But there will be a small proportion of women where there is the beginning of ovarian cancer, and we may actually be able to make a difference if they see a specialist early. If a woman does have ovarian cancer and it's an early stage, what we call stage 1, that means that the cancer is only in the ovaries, then this can be fully treated, sometimes even with keyhole surgery, without any need for any more treatment. The majority of women, though, unfortunately present at a later stage, what we call stage 3, where the disease has left the ovaries and it's in other organs inside the body. Surgery is important there, and it's always performed by specialist gynecological surgeons who have a cancer interest. But the majority of the women will need more treatment, such as chemotherapy. The message we want to give is that the earlier a woman sees a specialist, two things. One is, the vast majority of cases, ovarian cancer will be ruled out and the woman can be reassured. Sometimes we pick up benign conditions that can be easily treated with, say, keyhole surgery, and then again ovarian cancer is ruled out. Even if there's an early stage ovarian cancer, the treatment can be extremely successful surgically without the need for more treatment. If, on the other hand, this continues, that is, the women present at a later stage, then the survival will not be getting better. So there's a big awareness campaign going on in the UK and in the United States and other countries for women to be simply aware of the change in the symptoms, see the practitioner early, seek support from the gynecologist as early as they can, and the chances are they will be reassured, or if they're not reassured and there is indeed an early cancer, they can be cured.